I've got more or less the same problem as Don. I've got an Afrikaans name and I look white, inside I'm black. I've been working in Swaziland for 26 years as a missionary. It's also my first and only congregation that I've served in the southern area of Swaziland called SHBC. And this is where we've started our ministry amongst people with HIV and AIDS. And an organization started which is known as the SHBC Reformed Church Home-Based Care. Very long name, we just usually refer to SHBC Home-Based Care, just to make it a bit shorter. But that's the full name. Let's go on to the next slide. I want to just share with you the vision and the mission statement to become the hands and feet of Christ in this community. And then the mission statement: in a community devastated by poverty, sickness, broken families, and death, we want to bring back true Christian hope, not only through our words, but also following the perfect example of our Lord Jesus Christ by reaching out in love to those in need, comforting and supporting them by all means available to us. And this is a story I would like to share with you today of how we started with this work and how things are being done at the moment. And I'm going to do it by way of two stories. First of all, my story, and then our story. And then weaved into these two stories is a third story, which is God's story, because we believe what has happened in Swaziland with this work that we've been involved with is not really only our story or my story, but it is essentially God's story that we need to share. My story, as I've mentioned, I started working in Swaziland in 1985, 26 years ago. And a few years after I started working there, we heard stories of people dying of some strange sickness, and nobody really knew what was going on, but more and more people were telling us that the people are dying, and the words that they were using is, they say to me, "Mfundisi, the people are dying like flies." And that's terrible to hear when you're a missionary working in a country like Swaziland with less than 1 million people, and to hear that people are dying like flies, and you start realizing that something's wrong. And I had a colleague at that stage. He's now a missionary in Botswana, but he was helping me, and he's a doom prophet. He was always looking at the black side of everything. But he was telling me about this terrible disease, AIDS. And the words that he used was, in a few years' time, we won't worry about anything else. The only thing that we'll ever speak about will be AIDS. There won't be any political problems anymore because the people will have died in any case, so there's no political, any issues left. I listened to what he said and thought to myself, well, I think probably it won't be as bad as that. But I started getting an interest in this topic, and it happened that I was at that stage working on a PhD, and I was working with a professor at UNISA, and he was probably the first person who, in South Africa at least, the first theologian that really started getting involved in the issue of AIDS and what we as Christians should do. And he wrote a book with the title AIDS, the Leprosy of Our Time. And obviously, I had a moral thing, about this. I had to buy this book, so I bought the book and I asked him to sign it and so on. But I read it as well. And as I read this, I started realizing, my goodness, this thing is really serious. This isn't just something that's affecting a small number of people. This is really going to become a huge problem. And I then went to the Swaziland Conference of Churches, which is an interdenominational ecumenical body in Swaziland, and I went to the General Secretary. I said to him, what's the possibility of arranging an AIDS conference for church leaders in Swaziland? And he was excited about this. They said, well, let's do that. Can you get someone to speak? And I said, of course I can get someone to speak. So I phoned my friend in Pretoria. I said to him, we've booked you. Would you be willing to come? And he said he'll come. And we arranged everything. And about 3 months before he had to come, and that was the time, the story is that was the time when David Bosch was head of missiology at UNISA at that stage, was killed in a motor car accident, and this other man had to take over from him. Willem Simon had to take over his work, and he phoned me and he said, I'm very sorry, but there is absolutely no way that I can come to Swaziland for a few days. And I said, well, everything's been arranged. What are we going to do? And he said to me, well, why don't you speak? And I said, well, yeah, I don't know anything about AIDS. And he said, come and visit me and I'll share with you whatever I know. And so it happened that I was then forced into this position of having to be the keynote speaker at the conference of the Swaziland Conference of Churches, where I had to speak about AIDS, which I didn't know much about. And I prepared myself and got more and more interested in this topic. And after the conference, I said, well, I think I need to just to keep up to date on what's going on, which I did. Eventually, in 2004, I was approached by a friend of mine in America who asked me to write an article in a journal about AIDS and about why are we losing the battle against AIDS. And on the grounds of that, I was invited in 2005 to go to the Netherlands at the meeting of the lieve land, wat is die dingse naam? Reformed Ecumenical Council, sorry, that I was asked to present some workshops at that conference. Koenie Burger was also there. I think he's the only one around here that attended that conference. So I went and prepared myself, and I remember how I was sitting in my office one day, air-conditioned office, computer, everything, working on the things I wanted to say, and suddenly I got this very, very uncomfortable feeling, as if God was busy trying to say something to me, and what He was saying I wasn't really prepared to hear. But what came up in my mind was that God was trying to tell me, it's very nice to sit in your office with your air conditioning and your computer, thinking academically about the problem of AIDS. But what are you going to do to make a difference? And I can still distinctly remember that day when I was sitting in my study at home and just suddenly realized that I can't continue working on paper about this problem. We'll have to do something to make a difference. But I didn't know what to do. So I then went to the Netherlands. We had this conference, and between the second, that was 3 workshops that I had to lead. Between the second and the third one, something happened. We went out to a church in Rotterdam. And you all know, you've all heard stories about the Netherlands and how things are. And we went to a church in Netherlands, in Rotterdam. Most churches in Europe are growing smaller very, very quickly. And this church was growing, at quite a rate. It was growing larger. So I said to myself, either they're doing something right or they're doing something terribly wrong that people are really interested to go to this church. But I had the feeling that probably they were doing something right. So I wanted to find out what are they doing. And as we arrived at the church, people were standing around outside. I slipped into the church and I went up the stairs, and there's an administrative block there, and I looked around and I saw their mission statement, and it said that they were there to reach out to the drug addicts and the prostitutes and all the bad people, and they had a large map of Rotterdam on the wall, and this was divided into zones, and they had names of people in these zones, and I didn't know what it was all about, but afterwards the pastor told us that they divided Rotterdam into these zones, and they have church members in these places, and what they do is to reach out to the people in this small area where they live, in the few houses or few blocks from where they live. They reach out and they try and do something to help the people. So okay, that made sense to me. And then we went for lunch after the service, and having heard this man speak, we went for lunch. Now, just to give you the background, it's mostly very prominent church leaders from all over the world that were gathered at this meeting, and very important people, and theologians and professors and moderators of the church and general secretaries and all these very, very influential people were gathered in this dining room where we were having lunch. And while I was eating, I noticed an old man, badly cared for, shuffling into this room, and he came from the streets and shuffling into this room. And coming from South Africa, and with my own background, I felt sure that what was going to happen was that 2 young people would stand up and just gently take him outside, because he didn't fit into this into the atmosphere of what we were trying to create there in the dining room. And then two ladies from this congregation stood up. And they went to this man and they asked him, could we bring you some lunch? And that, I call that my second conversion. When that happened, I was sitting at my table, I broke down before the Lord. And in my mind, I cried out to God. I said, God, what can I do that my church in Swaziland could become like this church? Now, you don't usually use a church in Europe as your example. But I did. I said, what can I do that my church can become like this church? Because I was sure that that man on that day had experienced the love of Christ in a very, very distinct way. And this thing touched me. It was, someone used the term holy moment. That was a holy moment in my life. And we left by bus. We went back to the city of Utrecht. And on this bus, I made sure that I was on my own. I didn't want to speak to anyone. I was just thinking about what had happened that morning. And I was sure that God in some way had spoken to me. And I didn't know what it was all about. And I was sitting on this bus and I was on my own. I was praying and asking God, what are you trying to say to me? And for the first and only time in my life, I can really say that I heard the voice of God on that bus between Rotterdam and Utrecht. And what God said to me was, go back to Swaziland and go to your church and let them become the hands and feet of Christ in the community. And suddenly, everything made sense. I've been praying about getting involved in AIDS for quite a long time, and suddenly everything made sense to me. And this was, interestingly enough, this was at a time when everybody was praying and asking God, expand my territory. And God was saying to me, make your territory just a little bit smaller, make it manageable. Go into the community and start making a difference in the community. Well, we then, you can go on. I went back to Swaziland, and I stood up the next Sunday in the church, and I said to the people, this is what happened to me. This is my story, and I want us to start praying about this. How is this going to be to make a difference in our church? And I started preaching every Sunday. I was preaching about the same topic. This is that God loves people. And God wants us to love people, and God wants us to make a difference in people's lives. And God cares about people who are sick, and God cares about women, and God cares about people who are in bad situations. The one sermon that I distinctly remember at that stage was in Luke 5, and that is the story where a man with leprosy came to Jesus and knelt down before him and said to him, Lord, if you want to, you can heal me. And then something is written there which was, in all the first three Gospels, Matthew, Mark, and Luke, where this story is told, exactly the same words are used. It says that Jesus reached out and he touched the man. And he said, I want to be healed. Now remember that in those days you never touched anyone with leprosy, because that would immediately mean that you're not allowed to be part of the church anymore. You had to go through a lot of rituals to make yourself clean again. Jesus reached out, he touched the man, and he said, I want to be healed. And suddenly I said to myself, well, if Jesus did that with people with leprosy, that means that if someone has AIDS, I have to touch that person, physically touch that person. And then I made this decision to myself, well, whenever I see anyone that I know who has AIDS, I'm going to touch that person. Not only touch them, I'm going to put my arms around that person. Because I know, I've got enough savvy to know that I can't get infected merely by touching anyone. But most people don't know that. And therefore, people with AIDS are pushed away out of the community. And I said, but as Christians, we need to start bringing those people back in again. And one of the ways in which to do that would be by touching them. So I went on and on, preached every Sunday, and then in November of 2005, we had an AIDS conference where we invited a number of people. Actually, the Sunday before, a few Sundays before that, I said to the congregation afterwards, sit down, you tell me, what are we going to do? And they said to me, let's get involved with people with AIDS. So that was their decision. Then we arranged for an AIDS conference, and we had invited a number of people to come. And one of the people who came to speak to us was a lady who was involved with home-based caring. And we listened to all of them, and then broke for lunch and came back afterwards, and we divided up into smaller groups. And I said, now, okay, all of you smaller groups, speak about this topic. What are we going to do? How are we going to practically make a difference in this where people have AIDS. And they said, this is what we want to do. We want to go into home-based caring. So in January of 2006, we decided to train a group of people. Now, the story behind this is that I prayed and said to God, I made an agreement with God. People in the Bible did that sometimes, you know. I made an agreement with God. I said, well, God, if you give me 20 people, I will take this as a sign that you want us to go on with this work. And so on the day that we started the training on a Monday, it's Monday to Friday that we did the training for a week. On the Monday, I arrived at the church in Swaziland where the training was going to take place, and I was quite excited, and went inside, and quite a number of people were sitting there waiting for the training to start, and I counted them, and there were 21. So I said to myself, well, that's fine. That's, clear sign from God that this is what He wants us to do. So I was very satisfied about this. On the Tuesday morning, I got up, and it was pouring with rain. Now, in Swaziland, people don't have, or most people don't have cars. And the people that I work with in the southern area, no one in my church has a car. They just don't have the money for that. And so I knew there's no way that they would come to the church on that day. They don't come to church on a Sunday if it rains. So I was very disappointed, and I think arguing with God about this, and just saying to God, well, God, we were willing to do this, and if it's raining, the people can't come. That's a problem. So I went through and drove up to the church, and I had to meet the trainers. They were from South Africa. I just couldn't leave them, so I went up to them, and the three of them were standing outside under a little roof, and stopped my car. I got out with a smile, I said to them, where's all the people? A stupid question to ask when it's pouring with rain. Oh, they said, they're inside the church. And I went inside the church, and there were 26 people waiting for me, 5 extra from the previous day. On the Wednesday morning, I arrived there. There were 36 people waiting to be trained. So we went on with the 36. Eventually, 32 of them joined up, and they started to work. And in this process, God taught myself. Forget about the others, just myself. So many lessons about depending on Him for what we need, money-wise. One of the things that we went through was we made a plan to feed orphans. We started an orphan feeding program at our church, but we didn't have money. We started this project literally without a cent. We didn't have a single cent to our name when we started this work. One of the chiefs came to us and said, would you be willing to help feed the children? I said, okay, let's look at this. And they said, we'll help you with food. And so for 3 days in a week, we started feeding the children. And then someone said, well, what about the other 2 days? I said, well, obviously they're going to be hungry the other 2 days. And they said, well, we'd have to do something about this. And I said, well, we don't have money. And they said, well, can't we depend upon God? So they're teaching me a lot of stuff, Can't we depend upon God to help us with this? So I said, well, probably we can. So, let's see what happens. And in the back of my mind, I thought, I'm sure that, I speak to my wife, and she's a teacher. She's got a salary. I've got a salary. It's, we'll just pull something. And so it's the easy solution. Let's do it ourselves. And that was on a Monday. On the Wednesday, I got a phone call from a friend of mine who said to me, I had to come and see her. Went to her on the Thursday, and she said to me, where are you getting your food from for your feeding program? I said, well, we don't have food really. Getting a little bit from the community leaders, but that's all. She said, well, have you ever tried going to the hospital and asking them? I said, what do you mean? You don't get food from a hospital, you get it from a mill or from a grocery store or something. No, but they've got food for people with feeding projects. Have you spoken to them? So I drove down to the hospital, and first person with a uniform on the corridor, I stopped her and said, I need to speak to someone about food. And she said, oh, I'm the one you need to speak to. Went to her office, and I told her what we're doing, and she said to me, what type of vehicle do you have? Do you have a van, a bakkie, or do you have just a car? I said, well, I've just got a sedan. She said, oh, that's a pity. We won't be able to get much food into that car. But I'll tell you what, you take whatever you can, put it in your car, and then you come back and you fetch some more. And we were getting bags of 50-kilogram bags of maize at no cost about 10 kilometers from our church. At the moment, they're delivering that food at our church. We don't even have to go and fetch it anymore. They just bring it along and deliver it to us. One of the many ways that God really started providing in our needs. In January 2007, we trained a second group. So after a year, that I made a decision that I'm not going to train a second group before 1 year has gone past. I wanted to sort out all the teething problems and things like that. So in 2007, we trained the second group at a place called Matanjeni. Matanjeni, by the way, means dead bones, skeletons, something like that. And we've really seen how the prophecy in Ezekiel became true, where God blew life into these dead bones. So that was our second group that we trained, and then we trained some more. By the end of 2007, we had 6 groups, approximately 180 volunteers. By the end of 2008, 12 groups with 400 volunteers. By the end of last year, 22 with 700 volunteers. And at this moment, 26 groups with 800 volunteers. And when I say volunteers, I mean volunteers. Nobody in this project gets a single cent in terms of salaries. Well, we don't have the money to do that. If we had, we would probably have considered it. We don't have the money to do that. And in any case, when we do get money, there's greater needs. We need to get medicine. We need to get food. What we find is that people with AIDS going onto medication, ARVs, if they don't eat, they die in any case. They can't take the medication without eating. So we often find that our caregivers go back to their own homes, fetch food from their homes, bring it along, and feed the people that they are supposed to care for. And they themselves don't have enough money for their own food, but they start sharing this. And by the way, many of our caregivers are HIV positive themselves and also on ARVs. So it's this caring community that's being created where people start caring for each other. You can go on. And just to give you an idea of the results at the moment, we're meeting approximately 2,500 clients per month. Almost 6,000 visits take place per month. Of them, 22 clients are terminally ill. More than 800 are on ARVs. And then the other day I was sitting at a synod meeting. I'm not very fond of synod meetings. That's a very official church meeting in the Reformed tradition. And I was sitting there, and one of the other pastors said to me, we're very glad to hear about all the wonderful things that you're doing down in your congregation in the southern area and so on and so on. And he said to me, but I think you're missing your calling. You must remember that you were called to Swaziland to be a preacher. And it seems that you're giving so much time to this AIDS project that, I think you're not doing your work anymore. So one of my elders from my church stood up and he was very angry about this, and he defended me. And after a while, and then they went on and said, and you must also remember that you were called to evangelize the people of Swaziland. I said, yes. I said, after a while, I said, okay, let me speak. And I had my laptop with me, and I opened up a report. I said, well, I'm just taking a random report. That was the month of May. This, what you see is the month of June. I said, during the month of May, we prayed in at least 1,300 homes. Not 1,300 times, 1,300 homes we prayed with people. We read from the Bible in the homes of over 1,000 people. And we, at that stage, that month of May, 299 people heard the gospel. We do our training through, prick your ears, we do our training through EE3. You'll be glad to hear that. And many of our people have been trained. They've been taught how to share the gospel in an understandable way. In the month of May, 299 people heard the gospel, explained to them. Many of them made commitments to the Lord. And then as last resort, this pastor said to me, but are you discipling the people? It's good to have all these people that have accepted the Lord, but are you discipling them? I said, well, yes, we continuously go back to their homes and we just keep on with this process. That's just an idea, short in a nutshell, what we're doing, how we started and where we are now. Someone also made this, I think you, Francois, I think you said that God very often uses people that are not very You know, they're not in the front of things, and that's where I find myself. That I've always been, you know, probably more quiet and you know, not really on the forefront of things, and suddenly found myself in a position where God had called me, almost like Paul, you know, that the one that no one would ever think God would call for this type of work. And I suddenly found myself in this position of managing 800 people, visiting 2,500 people, and continuously expanding. We're planning our next training session early next month, when we'll be training another group of people. And it's always communities coming to us, asking us, would you please come and train us? We also want to try and help our people. Not once have we ever gone out to recruit anyone. It's always people coming to us and saying, we've heard of what you're doing, and we would like to be part of this. There's other groups working as well. World Vision is doing great work, and other people. And yet we find that many of them say, we don't want to be part of those groups where we can earn salaries. We'd rather prefer to be part of this group where we can serve God as volunteers and really make a difference in the community.